Hi all, it's Olivia, and I'm presenting on my first CEER titled Motives for Medical Misuse of Prescription Opioids Among Adolescents. In recent years, there has been a rise in the prescription of opioids among adolescents and young adults. 4 out of 5 use the prescription appropriately, while about 20% misuse it by either using too much or using it to get high. The appropriate medical use of prescription opioids is not associated with substance use, while the improper use leads to an increased risk for substance abuse. There is a lack of longitudinal research in this area, and this is one of the first studies to bridge that gap in the research by studying prescription opioid use over time in adolescents. So objectives of the study were as follows. The first one was to examine the prevalence and the patterns associated with past year medical use, medical misuse, and non-medical use of prescription opioids among adolescents over a 2-year period. The second was to examine substance abuse, sleeping problems, and physical pain symptoms that are associated with those patterns. A web-based survey was self-administered to a little over 2,000 middle and high school students in 2 years in 2 Detroit metro school districts in the US. 51% of the sample was female, 67% were white, 28% were African American, and 5% were of other racial or ethnic groups. These are the measures used in the study. So medical misuse, medical use, and non-medical use of prescription opioids were assessed, as well as motives for non-medical use of prescription opioids. Prescription opioid use behaviors were assessed, and various drug and alcohol screenings were administered in the survey, as well as an assessment of sleeping problems and physical pain symptoms. Results of the study indicated that a little over 16% reported past year use of prescription opioids in the first year of the study. 9.1% reported medical use only, 2.1% reported medical misuse only, 3.7% reported non-medical use for pain relief only, and 1.2% reported non-medical use for non-pain relief. Of those reporting no prescription opioid use in year 1, 11% reported past year use in year 2. 1/3 of adolescents who reported appropriate use of prescribed opioids continued use into year 2. 76% of non-medical users of prescription opioids were motivated solely for pain relief, and this was especially true among girls. The odds of a positive screen for substance abuse in year 2 among medical misusers were 3 to 5 times greater than non-users. Also in year 2, the odds of a positive screen for substance abuse among non-medical users for non-pain relief motives were 6 to 9 times greater than non-users. As well, sleeping problems among appropriate users were prevalent, especially among boys. In sum, most adolescents are appropriate users of their prescribed opioids. About 10 to 20% of adolescents were prescribed opioids, which is a cause for concern as opioids are highly addictive. And as results from the study show, 33% of even appropriate users continued use from year 1 into year 2. Motives for use should be considered in future studies on opioid use for all age groups. And finally, screening and brief interventions at the time of direct contact between prescribers and patients would be beneficial for youth who are prescribed opioids. Thank you for watching.